You've just given birth and now going to the toilet feels impossible. It hurts, you're scared to push, and no one warned you this would happen. Now stay with me because there are safe ways to fix it, and I'll give you a few tips to get things going. Assalamu alaikum, my name is Dr. Azad. I'm a medical doctor and a pharmacist working here in the UK. Constipation is extremely common after birth. You're not doing anything wrong. It's your body adjusting, and it's more common than people admit. So let me just give you a few quick reasons why it happens in the first place. Number one, your muscles are still recovering, especially your pelvic floor and abdominal muscles. They've been through a lot and they don't bounce back overnight. Number two, you might be dehydrated, especially if you're breastfeeding or you've lost lots of fluids during labor. Number three, pain relief during labor, like opioids, just morphine, that can really slow down your gut. Number four, it's fear itself. If you've had stitches or a tear, you might be holding back without realizing it. You're afraid it's going to hurt, or worse, that something might reopen. And finally, number five, not moving around much after birth does slow down digestion too. These are symptoms I commonly hear from my patients. You feel blocked, you feel bloated, you feel crampy, and the way to explain it is like there's pressure in your lower tummy area. And when you do finally go, it's hard, it's dry, and it's painful. Some women even hold it for days because they're just simply scared to go. This can make the problem even worse and can lead to worsened pain, small tears, and even hemorrhoids, which adds to the pain. Here's what I recommend: safe, gentle steps that actually work. You've got to hydrate, so you're going to aim for 2 liters of water per day minimum. Add an extra glass of water after every feed if you're breastfeeding. So the moment you wake up, some warm water first thing will help stimulate your bowels. Definitely heard this before, increase your fibre, but that's not it. That's just maybe 50% of what you need to do. You need to add more oats, prunes, fruits with skin, and whole grains. But the key thing is, with fibre, go slowly. If you have too much fibre all at once without water, it will make things worse. So slowly add your fibre and rehydrate at the same time will get things moving. I know it's difficult, but you've got to move. Even short walks around the house will definitely help. Movement stimulates gut contractions. A cheap walking pad online may be a good investment if you have the space for one. When using the toilet, place your feet on a low stool so your knees are above your hips. This helps open the rectal angle and makes it easier to pass motion without that dreaded straining. Next thing you could try is gentle laxatives. Now these are safe short term. There's many options. You've got lactulose, which is a softening syrup that pulls water into the stool. So you've got Docuzate, another form of a laxative, and that's a stool softener that makes it easy to pass. And there's also fibre gel, a bulk forming fibre drink. For this one, the great people to ask is your local pharmacist. They'll help you choose what's safe, especially if you're breastfeeding. In the UK, these typically cost between £3 to £6 over the counter. The laxatives to avoid are stimulant laxatives. So avoid stimulant laxatives like Senna unless your GP has advised it. They can cause cramping and aren't the first choice post-birth. Now here are the red flags of when you should see a doctor. If you haven't had a bowel movement for more than 3 days, if it's just too painful or you're bleeding, if you're getting fever, chills or nausea with it, speak to your GP or midwife straight away. They'll check for any underlying issues like hemorrhoids, fissures or infections. And if you're taking iron supplements and notice black stools or worsening constipation, this can be a side effect. Don't stop the iron on your own, but speak to your GP about switching to maybe a gentler formulation. I know this is a difficult topic. It's awkward. It's not really talked about much, especially online. No one tells you this before birth, but you're not alone. So many ladies suffer from this, but it can be sorted. Most postnatal constipation improves within a couple of weeks with just following these few simple steps, and you're not damaging anything by going. So if that helps with the fear, please don't be scared. The body is designed to handle this, so hang in there. I know it's difficult. If you found this helpful, please follow for more honest doctor-led advice to support your recovery and well-being. Inshallah, I'll see you for the next video. Take care. Assalamu alaikum.